Hello. So I'm going to re-record this for the third time. I don't have my daughter here with me, so we're just gonna go through everything. I don't have anyone to ask me questions. Um, Today we're gonna talk about breastfeeding, and we're gonna talk about establishing a good first latch, different positions that can be helpful for a new mom, um, and a few different other things that are pertinent for breastfeeding. So when babies first come out, they have two reflexes that are important for breastfeeding. The first one is on the back of their head. And if you notice, when you touch the back of babies' heads, they're automatically going to do this, which then will pop them off of your breast. And that reflex is used for when they're coming down and opening up your cervix. They use that type of part of their head to open up the cervix. The other reflex that baby has is on the bottoms of their feet. They have what's called the stepping reflex. That is used in utero during contractions to push against the top of your fundus, and it helps them push as their head pushes down, their feet push down as well. And that helps so that when baby is born and put directly on our chest, they have the reflex of being able to do the breast crawl, which means when baby's placed here and their feet touches our bellies, then they will miraculously start crawling and pushing their feet up to find the breast. Um, One of the other reasons why we don't wash our breasts or with soap and water in the first 24 hours is so that because our nipples and our areolas give off the scent of amniotic fluid, and that's the scent that they smell and are comfortable with, so that's what brings them easier to our nipples. Some babies in the beginning will do the breast crawl if you give them long enough time, and they'll be able to latch. But we want to make sure that they have a deep enough latch so that they don't just latch onto the nipple and cause nipple pain and discomfort for mom. So things that you can do to help baby latch would be there's four main positions that and there's four main positions. We'll go through that, and then we'll also go through what positions I recommend new moms using. So typical one is the cradle, where the arm that is the side you're nursing on holds baby, and then the other hand is what cups your breast. And then you would bring your nipple to baby's nose, which will allow baby to bring their chin up. And you tickle their nose and the top of their, right above their upper lip. And you wait for them to have a really big open. And then you bring baby to your nipple. Now, the hard part with that position is babies are very floppy and you don't have a lot of control with baby. So, the other position I recommend would be the cross cradle. So, you take your hand in a C position. I don't have my baby with me, but you would hold it on the backs of both of the baby's ears so it avoids the top of baby's head. And then your hand is on the top of baby's like shoulder blades. And then this way you can use the same arm that you're breastfeeding on and use that to support your breast. So you would take your thumb on the top and your other fingers on the underside, making sure that your fingers are far enough away from your areola and breast tissue so that when you bring baby on, they have a deep latch onto your breast tissue. Um, Most new moms bring babies a lot closer to their breast and farther down. What we want is we want to have an open space with baby's chin to chest. So we want you to look for that opening. If you don't see an opening, just slide baby down a little bit and you'll see that they'll open up more. Now, when we bring baby to us in a bottle position, their chest and their belly is upwards and we feed them a bottle. Nursing positions, you want to turn baby so that their nose, chin, chest, belly, and groin area are against mother's skin. So whatever position you're doing, whether it's the football hold, whether it's the cradle position, the cross cradle position, or the side lying position, we want baby to be brought into us. So that brings us back to the different positions. The other position, which I find is very helpful for new moms, is the football hold, because again, you have control of that baby's head. So that position, you'll turn baby to your side where baby's belly is here, and then you can bring baby's head to us rather than taking our breast and going towards baby. When we do that and bring our bodies to baby, we end up with stiff necks, pain in our neck, pain in our chest, and we're very uncomfortable. So the fourth position would be side lying. Side lying position is the best position we can teach new moms because that allows them to sleep safely while they're nursing. When it's quiet in the house and you're sitting up straight, then you run the risk of falling asleep, and then your arms drop and fall, and then that risks the baby falling out of our protection. So we want to make sure that moms are comfortable. If you find it more comfortable to be sitting up, then use a pillow called the Breast Friend pillow. I recommend that pillow versus the boppy pillow. Most moms find that the boppy goes around us, but it has a big space in between, and babies tend to drop through that. Also making sure that you have a lot of extra pillows around you to prop up. Once you latch baby on one side, we want them to finish out nursing that side. And then when they finish and they pop off or fall asleep, then you bring baby to your chest and keep them upright and let them regroup. And then usually it's about a 10 to 15 minute pause. They'll wake up kind of squirmy and you can latch them on the other side. That second side is going to be a very short nursing. It could be anywhere from 5 minutes to 15 minutes. And when you finish on that side, you want to make sure you start on that side the next time around. Some babies are very efficient and they'll just nurse on one side and then they'll get a 2-hour break and then you nurse them on the other side. If they do that, then you can always hand express to give yourself a little bit more comfort if your breasts are getting engorged. But we wouldn't recommend pumping until about 4 weeks postpartum until you have established breastfeeding milk production pattern. What happens with pumping is it stimulates your breast just like a baby does. So your body's going to go, oh, you're emptying. I need to create more milk. And then at the same time, the next day, you'll have more milk when you don't need it. And that can be even more painful. Ideally, we don't want to introduce a pacifier as well until about 4 weeks because we want to establish a good deep enough latch for baby. When you introduce a pacifier, the muscles that they use are more of a gnawing or their cheeks to keep it sucking. When babies nurse, they're using their tongue, and we want them to stay with just using those muscles. And once they've established a good nursing pattern with those muscles, then we can introduce a pacifier. Normal things to look out for when a baby latches. A lot of new moms will call us and say, my baby keeps falling asleep at the breast. But the question is, are they really falling asleep or is that just the newborn pattern? The newborn pattern looks like this. Babies latch and they do a quick suck. So suck, suck, suck. And then they do big sucks, which start just drop. The suck, suck, suck initiates a letdown. The big sucks then start pulling that milk out and then they stop nursing. They'll still be attached and you'll feel a vacuum suction, but they won't be sucking yet. What that does is it allows the milk to start pooling in the back of their throat. So they're taking a break and letting that vacuum from their mouth to your breast pool. When that milk fills up the back of their throat, they'll swallow and then they'll start that pattern again. They'll go back to that suck, 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 big sucks, no suck, swallow, suck, 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 big sucks, no sucks. And that's a normal pattern. That doesn't mean that your baby is sleeping at your breast. Breast milk causes babies to release oxytocin. So it is a natural sleep aid for babies. So they will naturally look like they're sleeping, even though they're sucking and swallowing. A good cue to look out for when they pop off if they are actually full or not. Babies who are hungry will have fists up to their mouths. Babies who are somewhat satiated will have lighter fists, so fists but not as white knuckled, and they'll be more at their chest line. Babies who are full will have loose hands and their hands will be floppy, where you can like pick them up and it just flops down. So those are a few keys to look out for. Is my baby hungry or is my baby full? Why is it important to nurse your baby within that first hour or two after birth? A few reasons. One reason is it's that bonding between baby and mom. It establishes a good safety net for baby. It stimulates our breasts to start going into that postpartum mode of, okay, I'm now taking care of baby. I have to produce colostrum. I have to start producing, and our hormones start taking over. Okay, normal weight gain and weight loss. It is normal for babies to lose about 10% of their birth weight in the first 3 to 5 days. However, that's the highest point of normal. So, nursing on demand and following babies' feeding cues will help to alleviate a significant weight loss. Feeding cues for baby will be, and early cues will be, they'll kind of start smacking their lips, they'll start rooting, they'll start looking around side to side, maybe even sucking on their hands. In the active cues, they'll be really rooting side to side. Their rooting will look like this, where their tongue kind of comes out. They start squirming and looking uncomfortable. In those time frames is the best time to latch baby. Once you get to the late onset of hunger cues where they're crying, they're frantic, it's going to be very hard to latch a frantic baby. So at that point, you'll need to calm baby before you latch a screaming baby. Other things to look out for is their peeing and pooping. Okay, so within the first 24 hours, they should pee and poop at least once. So 1 urine, 1 poop. Day 2 would be 2 urines and 2 poops. Day 3 would be 3 and 3. I will give you out a paper that shows you the normal color of baby's poop. So in the first period, it's going to look like this. It's going to be black and it's going to look like tar. It's called meconium. As your colostrum starts switching, it starts looking a little less thick and black and has some green to yellow. Day 3 and 4 starts looking, has more of that yellowy brick color, mustardy color, and then it turn to that mustard seedy look, which helps with, which means that they're getting all the meconium out of their system. Another thing to keep in mind is how small your baby's belly is. So from day 1 to 5, it's the size of a small marble. Day 1, it's the size of a marble. Day 3, it's a little bit of a larger marble. And by day 10, it's the size of a golf ball. So really, in the first 24 hours, baby just needs a teaspoon worth of colostrum. And so you're going to bring baby to breast about 8 to 12 times in a 24-hour period. And it might be a 5 minutes and it might be 45 minutes. Um, when I had my daughter here, she had a whole bunch of questions. But I think that's all the information for right now. Have a great day.